This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Welcome back to another episode of the Best Health Podcast, brought to you with Wake Forest Baptist Health in partnership with MedCost. And glad you're listening once again. Hope you all have taken the opportunity to listen to a number of our Best Health podcasts that we've done recently. A fair amount of them have focused on topics around the COVID-19 coronavirus issue, but some of them are on other issues as well. So hope that you take the opportunity to find the Best Health Podcast in the store by which you listen to podcasts, or at wakehealth.edu/podcast. You can also find us in the Triad Podcasting Network family of podcasts online as well. So we do have another really cool guest, actually a repeat guest. She was with us a little while back, and we enjoyed having her, and she provided a lot of great information. So we wanted to invite her back once again. And it's Katherine Cheek, here with Wake Forest Baptist Health, and wanted to just continue the conversation on the mental wellness, mental health, mental wellness side of working through, I guess, the stage of COVID that we're in now. Before we do that, just speaking of COVID, I just want to remind all our listeners that we do have the resource available, the 24/7 COVID hotline at Wake Forest Baptist. That's 336-70-COVID, as well as our website, wakehealth.edu/coronavirus. So feel free to check out those resources for the latest updates and information. So Katherine, glad that you're back with us again. Thanks for joining us.
Thank you for having me.
So before we jump into kind of talking about our mental processing and managing our mental wellness during this stage of COVID, I want you just to remind us a little bit about yourself, what you do here at Wake Forest Baptist, and how long you've been doing it, and why you got into the practice that you are currently in.
Sure. So again, my name is Katherine Cheek. I'm a clinical psychologist. I've been practicing psychology for 25 years. I've been with Wake for 13 years.
Mm-hmm.
And I got into this field because I love helping people. And I just am passionate about it, and I'm thankful that I found a career path that enables me to do that. So.
Okay, there you go. That's good recap. Appreciate you sharing a little bit about yourself. And I want to move into, so, there's still, months later, as we work our way through COVID information, and there's just still consuming lots of our media cycle and lots of social media posts. Wanted to just kind of get your take. We initially went through this kind of shock to our system lockdown. We have to lock down, we have to self-quarantine. In almost all cases, schooling stopped and we went to virtual learning as opposed to in-person. And now we've been through this initial phase of hopefully trying to manage the stresses and the anxieties that come with this major shift in our lifestyle. And now we have things reopening. Healthcare systems are performing elective surgeries again. Certain businesses are reopened and based on guidance from medical professionals. So as we kind of transition from the initial phase to this phase, just wanted to get your take on what might be some kind of quote unquote normal reactions to reopening. There's probably a good amount of things that we go through in our mind, moving from step 1 to step 2 to step 3 to step 4, just to help us understand that and maybe put it into some words. What kind of a reaction we can help ourselves work through, or our significant others work through as we reopen.
Right. I think the interesting thing is that we're going to see a wide range of reactions to reopening. People have different levels of tolerance and vulnerability. And so we will see anything from people who are having extreme anxiety and still exercising extreme caution in the reopening, to the opposite extreme of people who are thrilled to resume normal activities, happy, making their dinner reservations the first night they could get out. So, so there's no one normal. There's just going to be this wide range depending upon people's levels of tolerance. And then one thing I want to emphasize to people is that it is typical for most people to experience some amount of anxiety as they resume normal activities after a long break. New things in life are often anxiety provoking. So after you've been isolated for a long time, it can feel very strange and stressful to get back out into the community again, to learn how to feel safe in this environment that you've been avoiding for potentially months. So I think emphasizing there will be a range of reactions, that it's okay if you're having anxiety, you're normal, that's very normal. And then also remembering that for people who are very introverted or people with social anxiety, the lockdown was a welcome respite for a lot of those folks. They love being at home with their immediate family, and they were able to retreat from a lot of their triggers for months while they were staying at home, while they were staying at home. So reopening for those people who are introverts and have social anxiety, their anxiety is going to be compounded. They're going to have the anxiety that everyone has of the fears of COVID exposure, but they're also going to be exposed again to all of the triggers that they had before. So I think it's important to recognize that for those people who already had anxiety or who are introverts, that the anxiety could potentially be a little bit higher for them.
Sure. That's great information. That's a good point of view. I guess to follow up on that, so with people experiencing different levels of risk tolerance, we have to work through our own processing of what we're comfortable with individually, and then the other people in our household potentially, what their covenant levels are, what their anxiety levels are, and then to go outside of that for your extended family, close friends, and then associates, coworkers, perhaps. There's a wide range of reactions to both the initial pandemic kind of shutdown and now, the various phases of reopening. Some people still want to stay in complete lockdown almost, if you will. And then, like you said, some people are just going out there and getting involved in as many things out in the public as possible now. So I guess, how do we work through that? How do we cope with that, both within ourselves, but then also, interacting with other people who might be at different comfort levels than we are?
Right. That's an excellent question. I actually recently was in line in a community setting, and the person in front of me in line looked back at me and looked kind of agitated and nervous and glared at me. And it took me aback for a moment, because I didn't think I was very close to him. But then it hit me that I was obviously closer to him than he was comfortable with, right? And I immediately stepped back, away, a little bit further away from him, and I said, "I'm really sorry. I didn't mean to get too close to you," because I assumed that's what had happened. And the lady behind me in line rolled her eyes and laughed. And I thought, we have got to get better at this. We have got to get better at this, all of us. Because I just thought it was sad that, that he had to glare at me as opposed to just asking me to give him some space. And I thought it was equally sad that, the person behind me thought all of that was funny.
Yeah.
Kind of mocked him and rolled our eyes at him. And so
Yeah.
I feel like this is an important question. I feel like we all have our own comfort levels, tolerance levels, and we have a variety. We're going to encounter people in our friend circle, in our family, and in our community who have different tolerance levels and they're taking different precautions or maybe taking none. And so I feel like the best thing we can do is try to practice giving ourselves and other people grace, recognizing that this is hard. None of us have ever done a pandemic before. And we all have different needs, different vulnerabilities, different levels of anxiety and risk tolerance. And so instead of criticizing people who are making different choices, just respecting them and understanding that we are all constantly weighing risks and benefits of activities and doing what we each feel is best. There's no right answer. And some of the things we do won't make any sense, and so I feel like if we can practice that grace, that will go a long way. It isn't guaranteed that grace will be reciprocated, and that's not why I practice it.
Yeah.
I practice it because it's the right thing to do, and it does give me some peace at the end of the day to know that I did the right thing and I practiced grace, even if it wasn't reciprocated. But the fact is, most of the time, if you can give people grace, you get it back.
Yeah.
And then secondly, communication is critical for any healthy relationship at any time. And so in the case of this, one thing I do is in advance of seeing people, especially people I haven't seen in a long time or since the pandemic started, I text them and I say, what are you comfortable with? What do you need from me? And I communicate what I need from them or what I plan on doing. And that just shows respect. And it also can help people be more comfortable deciding in advance what things are going to look like. I was meeting a friend for dinner who I hadn't seen since the pandemic recently, and I texted her in advance and said, I'm not hugging. I'm not going to hug you because I work in a medical setting and I'm exposed to a lot and I want to keep you safe. If I had not done that in advance, there would have been an awkward moment when we first saw each other. And one of us or both of us dove in for a hug because, she's an old friend and that's what we usually do. So I think communication in advance and being open and respectful can help avoid some of those awkward moments, and just accepting that we can't control other people. We've never been able to control other people. That's not a new thing. And I hear stories about people getting angry in public places and, yelling at people who aren't practicing the precautions they want them to practice. And I don't think any good is going to come from that. So I encourage people just to focus on what they can control, which is themselves and their own precautions, and try to let go and accept that you can't control other people. I think if we could just do those three things, Justin, if we could just give grace and communicate and accept we can't control other people, we would all fare a lot better in our relations and interactions with others as we reopen our communities.
That's great information. I think almost all of us can probably take a portion, if not all of that, and reflect and try and apply it to our lives as we interact with, with family, with friends, with the general public. Great information. So, I guess one thing that might lead to someone might maybe having a shorter fuse than normal is their heightened level of stress or anxiety. When someone's under a higher amount of stress or anxiety, maybe that's, how their mind, their body initially reacts is to maybe have a shorter fuse. What can you help us with, maybe a couple of strategies, to cope with the anxiety, as we come out of, self quarantine for so long, and we start interacting more with other groups of people in various ways. What can we do to help manage the stress and anxiety so that we don't maybe necessarily, yell at someone, or come off with a mean glare when, under normal circumstances we might not do that.
Right. I could talk for hours about strategies for anxiety.
Mm-hmm.
But if I had to pick one for this, it would be awareness of and acceptance of uncertainty. And I know that's really broad, but it's important. So uncertainty isn't new. We've all had uncertainty our whole lives. It's a part of life. It always has been. But right now, with this new pandemic, there are all these new uncertainties that we are plagued with, and we're all thinking about all those what ifs. What if we don't go back to school? What if I never go into the office again? What if we have to wear masks forever? What if our kids don't go to summer camp? We could what if constantly, with worst case scenarios about the pandemic and what life is going to look like for all of us financially, work, in school, so many ways. So what I try to encourage my clients to do is recognize that the pandemic is new, and some of these uncertainties that are popping up as a result of the pandemic are obviously new, but uncertainty in and of itself has always been an inherent part of life. And most of us have learned how to deal with it. So, and the other thing is, not all uncertainty is bad. We get good surprises too. Some of the best news, some of the best surprises, things in my life have been surprises that, I was uncertain about. So I think we often see uncertainty as negative, and it's very stress provoking, and reminds us of all those things we cannot control. So I'm just encouraging people to try not to constantly analyze and worry about the uncertainties and the what ifs. And, think about the ways that we've already accepted uncertainty into our lives every day, pre-pandemic. For example, crossing a street, driving, eating out. When you do those things, you're trusting that you won't have an accident, you won't get food poisoning. The chances of something bad happening in those circumstances is very small. So we accept the risk, and we move on with those activities without requiring certainty, right? This, again, I'm talking about pre-pandemic. So I want people to understand that uncertainty is here, but it always has been. And you were dealing with it, most of us were dealing with it fine before, and you can learn how to deal with these new uncertainties now. So one metaphor that I've been giving people to help with this is driving. I think we all know that there's risk associated with driving. And most of us in our country drive every day. So, we take precautions, we buckle our seatbelt, we follow the laws, we don't text and drive, we don't drink and drive, because those are things that minimize our risk. But we keep driving. And most of us don't, sit in our cars in fear before we drive every time we sit in the car. So to me, the life after pandemic is very similar. We need to take precautions to minimize our risk, but we don't need to dwell on the risk and let the risk or the fear inhibit us from living our lives.
Yeah, that's a good point. I think I guess it depends on the situation. We were able to accept risk for some things like easier than others. And like you said earlier, where most of us are working our way through a worldwide pandemic at this level for the first time. And just hear so much information coming at you if you allow it, it can come at you all the time, and if you don't set some boundaries.
Mm-hmm.
So with that said, accepting uncertainty is easier said than done in some circumstances, especially as we work through the kind of the next stages of COVID-19. How do we go about doing that?
Well, that is something that, a lot of people struggle with even before the pandemic.
Yeah.
So this isn't a new thing. And some people really need help in their struggles with how to actually operationalize accepting the uncertainty and how to
Yeah.
live that out. One trick that I recommend to people is I like to externalize the what if worries, the uncertainty. And that's a good way to raise your awareness of uncertainty is anytime we start looking at worst case scenarios or imagining them or what ifs, those are red flags that you're going in that uncertainty direction.
Mm-hmm.
And I like to empower people and myself to fight the what ifs as if they're a bully, right? I'm a very assertive person. I'm, feel very comfortable being direct. And if someone was bullying me, I would assert myself. I would stand up to them with my truth. And so that's what I try to empower my clients to do with these what if worries is see them as bullies who are just trying to infiltrate your thoughts and take over, which you could allow to happen. And if you allow yourself to dwell on the what ifs and the worst case scenarios, you will be very anxious. And unfortunately, that anxiety can negatively impact your ability to live your life and your health even. So I like to suggest that people have some key phrases that really resonate with them, and that they write them down on something like an index card and keep them in your purse, in your wallet, post them on your wall, put them in your car, keep them as visible as you can or as accessible as you can so that when those what if and uncertainties pop up, you can pull out that card and read some rational logic that is going to help you fight back against those what ifs. For example, some of the things I say to myself include, I will say, that could happen, but it's not likely to happen. So I'm not gonna dwell on that what if. Or I say, I refocus myself on the things in my control by saying, I am doing what I can to keep myself and my family safe. Like buckling my seatbelt, wearing my mask. I'm doing what I can. And that helps me fight back against some of those what ifs. And then, of course, reminding ourselves, just the truth is worrying about this will not prevent it from happening, but it will drain my energy and stress me out. So I'm not going to stay with that worry. I think if we can have those key phrases at the ready to redirect our thoughts when those what ifs and worst case scenarios come up, we'll be well equipped because they're going to pop up. They do for all of us. That by the way is normal too. For what ifs, it doesn't mean there's anything wrong with us because we're thinking about the what ifs and the worst case scenarios. It means we're normal, we're human. But then at the point that it pops up, we have a choice to dwell on it and let it fester and grow and harm us, or to, interject with healthy thoughts and redirect ourselves. It's a waste of time and energy to dwell on the what ifs and worst case scenarios. But my favorite empowering phrase that I like for myself is when the what ifs pop up, I remind myself that I can do hard things, that I have done hard things. And so if bad things happen in my life, and unfortunately they will, it's a part of living, that it'll be hard, but I can deal with it. And I'm going to deal with it when it happens, not before. I'm not going to sit here and dwell on something that may not even happen. So I think that's a key strategy is just kind of globally having some healthy truths that you can use to fight back when those what ifs pop up.
Yeah, I like that phrase, healthy truths. Let's if everyone listening and myself included, let's try and tuck that one away and pull it back out when we need it, because it does happen. Sometimes the what ifs start creeping up in your mind, or a certain situation can help trigger some of the what ifs. So that's good to keep in your back pocket. I guess to follow up on that, if something, especially when we're stressed, maybe we're not sleeping as well as we normally have been, or our diet, isn't as healthy as it has been pre-COVID. Our bodies might be at different stages of handling stress better than other times. What is there any tips or tricks to help people that we can jot down to help control our thoughts and refocus them to being more healthy and positive?
Sure, there are lots of tips and tricks. We talked about several of them in our last podcast about self-care to make sure you're meeting your physical, spiritual, cognitive, and social needs. So self-care is always at the top of my list.
Mm-hmm.
But in addition to that, really another one that's at the top of my list is mindfulness practices, mindfulness meditation. It's been around a long time. I think it is getting more and more attention. There's a lot of evidence, research that backs up the effectiveness in mindfulness in overall mental health and stress management. And so mindfulness practices are really honing your skills in focusing on the present, focusing on gratitude, focusing on acceptance, some of those healthy truths that that we were talking about earlier. And really your brain is, as you practice these skills, you get better at them, just like any skill, right? You practice it, you get better. So there are lots of apps for this. Some of my favorites are Calm, The Mindfulness, and Headspace, but there are many other venues for mindfulness coaches and coaching, YouTube, Amazon Prime, all kinds of resources for this. It is important to understand that it is something that you will not get, you're not likely to get an immediate result from it. It's not something you'll do one time and you'll feel like one and done, it helped relieve your anxiety. It's more something that it's a skill that you're beginning to develop, and with practice you will get better and better at that skill of mindfulness, and then you will begin to reap the benefits. But I think eventually we will be teaching our children mindfulness practices in school, because it is so evidence-based in terms of what it does for people's emotional health, ability to concentrate, so many different things. So I think a lot of people think it sounds hokey or on the fringe, and I want to be sure to dispel that myth and say that this really works. Again, not a quick cure, not a one and done thing. It's something you have to commit to practicing to reap those benefits. The other thing is learning to, accepting that worrying is a part of life, especially when we have so much going on like we do now, but choosing not to allow yourself to focus on the worries for extended periods of time. But yet we all know holding in negative emotions like worries for too long has a negative impact on us. So allocating a specific time of day and a buddy who you're going to have a worry time with, just 10 minutes to vent, think about, talk about all your worries and stressors. So you wouldn't want to do this close to bedtime, obviously. But, giving yourself a time to vent, but also setting a limit on it so that you're not allowing yourself to dwell on talking about or venting about these worries for extended periods of time, which isn't going to be healthy for you. If you begin to think about worries at another time of day outside of the worry time, you just are supposed to make a brief note to yourself about it and put it away until the designated worry time. So this is an intentional compartmentalization that can be very effective in letting people have a time to get support and vent and let out their worries, but also teaching them not to dwell on them for long periods of time. And then the last strategy that I think is critical, and you referenced it earlier, is choosing what you feed your brain. Setting some healthy limits for talking about the pandemic, for watching news and social media coverage about the pandemic, making sure that you choose trusted, informed sources of information so that you're informed but not immersed. Some of my clients choose to just, ask someone they trust to give them the information they need so that they, don't have to watch the news. Other people just set a time limit of how much news they're going to watch each day. And I think that's important because watching stories that focus on worst case scenarios and what ifs is only going to add fuel to the fire of what ifs that already pop up for us. And then conversely, you can feed your brain some positive things.
Yeah.
Instead of, so you're setting limits on the negative things, but also trying to feed your brain some things that make you laugh, some things that make you happy is going to be really important. So those are just a few things that I think tools that people could use to try to work on controlling their thoughts in a healthy direction.
Yeah, that's great. That's really interesting, the worry time, because, it's, I guess some people, including, myself, if this what if, or this, this thought that comes up that's maybe not completely rational, maybe the initial knee-jerk reaction is to say, okay, well, I'm just gonna suppress that feeling or that thought, and that's not, I can't worry about that right now. I can't think about that right now. It'll just go away if I just kind of bury it back under some sand and try and suppress it. But you're saying if there's a structured, measured way to verbalize it and externalize it, that can actually help us process through it in maybe a more healthy way. That's great. That's great information. As we're talking with Katherine Cheek, one of our licensed psychological associates here at Wake Forest Baptist Health. I did want to just kind of, as we're getting close to the end here, just touch base on, some people, maybe they were dealing with a certain level of anxiety or fear before COVID, and COVID just multiplied those feelings in some cases, and understandably so. For some people, some people might be just really, really, really still afraid to the point where they're still not leaving their homes at all. And I know in a previous podcast, we talked about, we don't want to become, too isolated. We want to be physically distanced, but not necessarily quote unquote socially distant. So there's some people that maybe aren't just really staying cooped up and closed up in their house, and maybe some of the historical social channels have been cut off. How would you speak to them right now? Maybe some advice to talk to them.
So I think the first piece of advice that I would give them is to focus on scientific facts and recommended precautions from the CDC. And the CDC has never recommended that you cannot leave your house or go outside, even at the beginning of this. And the second thing I would say is it's likely that COVID-19 will be with us for a long time. None of us knows how long. And over time, we will get used to this. We will get used to wearing masks. We will get used to physical distancing. And we will become comfortable living with the degree of risk that's related to this virus. Just like we're comfortable with the degree of risk that's related to driving. But the only way that we will get to that place where we're more comfortable is by facing our fears. So I would encourage people to begin re-engaging gradually, to identify steps to getting out of their house more. For example, I might suggest that they start by going on their porch and sitting outside on their porch, and then going into their yard, and then walking around the block, and just continuing those steps to getting out more and more. And what I'll explain to them is, yes, you are going to experience anxiety. I'm not going to gloss that over, but anxiety will not do you harm, and the anxiety will come down as you take these steps. Other steps might include talking with a neighbor outside while maintaining physical distancing, then maybe going to a curbside pickup at a store, then maybe going in the store with the precautions that are recommended by the CDC. So I will just encourage people to continue taking steps to move forward with the precautions, knowing that their anxiety, while it will be very uncomfortable, it will diminish over time. I always encourage people to control the things they can, and focus on that. That gives people a greater sense of control and gives them some certainty. So controlling their safety precautions, their masks, their physical distancing, avoidance of crowds, washing hands, controlling their self-care, controlling their thoughts, like we talked about earlier, controlling their media exposure, their communication. So I encourage people to refocus that there are a lot of things in their control, even at these times of uncertainty. Of course, accepting the uncertainty, like we talked about earlier. Yeah. Nothing in life is without risk. And then knowing their signs of anxiety and using them as cues for self-care. So, instead of seeing anxiety as this awful thing, accepting it, that it's normal. Everybody has different levels of anxiety. Yeah. And when know what your signs are, and when they pop up, use them as kind of red flags that it's an indicator that it's time to do some extra self-care or use some of these healthy coping strategies. But lastly, what I really want to emphasize to people is, if your anxiety isn't getting better, or if you're not able to do the things you need to do or the things you want to do, then it's probably time to get professional help. It's probably time to talk to your physician and start exploring some mental health care.
Yeah. It just, it's 2020, and Katherine, I know, I'd like to be in a place where we don't have to emphasize that that's completely okay, and people don't have to be, ashamed or feel any sort of guilt about that. But it's so important and can be so helpful, that I do want to reiterate that, that talking to a professional about mental health and mental wellness and working through issues is 100%, not only okay, but encouraged if you feel like you need to, correct?
That's right. I think, thankfully, we do have greater awareness about that, but some people do still have a stigma associated with mental health care, and it's a shame, because I believe that everybody needs mental health care at different points in our lives. That doesn't mean that everybody gets it, but I believe that everybody needs it. And if more people would tap into it, they would understand the benefits of it. So thank you for saying that.
Yeah, absolutely. Well, we're wrapping up here. I want to thank everyone for listening to today's episode with Katherine Cheek, as we talk about, different ways to process what we're feeling, the stress, the anxiety, verbalizing that, the way that we can positively interact with others as we kind of move into the next phase of COVID and interacting with more live human beings out and about. And as we close, I just want to remind people, I thought that was so great, what your earlier points were about, working with and coping with interacting with other people. And just remember that, hopefully we can all give each other some grace next time we're out and about, and that we can positively communicate with people. I think you're right. A lot of issues come about with just by simple miscommunication. So being able to clearly communicate what some expectations are can go a long way. So great information. I really appreciate it, Katherine. Thanks for visiting with us again.
Sure. Thank you for having me. I enjoyed it.
Yeah, absolutely. So everyone, please remember to, if you like this podcast, please feel free to share it with your friends and family. Encourage them to take a listen as well. Hopefully that lots of people will get something positive out of this episode, as well as some of the other episodes we have in the Best Health podcast library. So thanks everyone for taking some time and listening today. Until we chat again, please be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.